This presentation will introduce a new client and their current lifestyle, detailing the goals in which they require the assistance of an exercise physiologist to achieve. It will include the results of the new client screen, initial consultation notes including medical history, as well as various pre-screening tools to assess the client's readiness to commence an exercise program. It will include a breakdown of the client's exercise, health, and behaviour goals, provide a needs analysis, as well as evidence-based recommendations to shape how we will approach these goals. Our client is a 20-year-old male university student and part-time personal trainer weighing 108 kilograms at a height of 173 centimeters. His blood pressure, normal, but according to the BMI classifications, a BMI of 36 is considered obese. However, this measure has an inability to distinguish between fat mass and fat-free mass. Therefore, I would not recommend using this as an absolute indicator of health due to his broad muscular frame. 4 weeks ago, the client had a minor tear to his intercostal muscle. He was advised by his physiotherapist to rest for up to 3 weeks before continuing vigorous exercise. The client also has a history of infrequent non-specific lower back pain. Prior to the injury, he was performing a minimum of 5 hours of moderate to vigorous intensity exercise per week. He's currently only performing 2 to 3 hours of moderate exercise. He also has 3 years' experience in Olympic weightlifting. The reason for his appointment today is assistance in implementing an effective and safe exercise program to prepare for competition following recovery from injury. The PAR-Q Adult Pre-Screening and Fantastic Lifestyle Checklist were used to determine the client's safety and readiness for an exercise program. These indicate that the client has a low risk of developing chronic disease, therefore does not require medical clearance before commencing exercise. The client's overall goal is to increase competitive chances in Olympic weightlifting with minimal risk of injury. This has further been broken down into 3 specific goals. Firstly, his exercise goal is to increase the 1 repetition max for clean and jerk and snatch with minimal risk of injury. The National Strength and Conditioning Association have identified 4 key components for success in Olympic weightlifting, success being a large total for snatch and clean and jerk. These components are muscular strength, muscular power, flexibility, and technique. Correct technique and flexibility are also highly associated with decreased risk of injury, especially lower back injuries, which is vital for reaching maximum weightlifting potential. Although the client has experience in weightlifting, technique will be observed to identify and critique faults that have potential to cause injury. Common faults include excessive horizontal displacement of a barbell, premature arm involvement, incorrect catch position, and incorrect load. After this, a 1RM test for snatch and clean and jerk will enable us to program appropriate loads and repetition ranges. A vertical jump test will measure lower body power. Flexibility of the hamstrings and lower back will be assessed with a seated sit to reach. And ankle, hip, and shoulder mobility will be assessed with an overhead squat test. The client's health-specific goal is to lose 14 kilograms in 8 months to fit into the 94 kilogram weight category. Olympic weightlifting requires lean muscle to perform explosive movement. Therefore, it is important to achieve a loss of fat mass whilst maintaining fat-free mass. It is commonly accepted that between 0.5 and 1 kilogram is the maximum amount for healthy weight loss, which is what the client must lose each week to meet his goal in the time frame. To track changes in fat mass, skin fold measurements will be taken monthly. Weekly weigh-ins will also ensure sufficient weight loss is achieved in the time frame. To do this, daily energy expenditure also must be calculated, as well as the deficit required for weight loss. Finally, the behavioural goal is to increase overall physical activity levels, which will aid in achieving the previous goal. As the client studies full-time and runs his own business, he will benefit by improving his time management skills. A weekly planner incorporating work, university, and workout schedule should be implemented. To summarise, the client has no risk factors according to the pre-screening tools and assessment. However, care must be taken to reduce the risk of injury whilst increasing the 1RM of the 2 main lifts. Muscular strength, power, flexibility, and technique are vital to achieving this goal safely and effectively. Maintenance of fat-free mass should be a priority to allow powerful and explosive movements. This can be closely monitored using skin calipers and scales to ensure weight loss is occurring. Physical activity will inevitably be increased with the training required to meet the exercise goals with improvement of time management skills.